Hi, folks. This is Yvette from YvetteLaboy.com. For those of you who are not familiar with me, I'm a holistic health coach, lifestyle coach, Reiki Master, Magnified Healer. I work with people who are suffering from autoimmune diseases to help them transform their lives. I work with individuals who suffer from lupus, specifically lupus, on a physical, mental, emotional, and spiritual level. I work with the body as a whole to create healing. Hi, Patricia. Create healing, well-being, and transformation. So prior to being a health coach, I was a professional singer. As you may or may not know, I suffered lupus for about 17 years of my life. Today's topic is going to be about lupus and the heart. And one thing I want to share with you folks, and I share this every time I have one of my live chat, is that, hi Edwin, thank you for joining, and Patricia, is that the body has its own innate ability to heal. Thank you for the thumbs up and the hearts. And if you give it what it needs, and you get in tune with your body, it will give you clues as to what it needs to nourish it and to heal it on every level. So I want to pour my knowledge into you again this week and teach you a few things about lupus and the heart. So get comfortable, stay a while, hang out with me. I'm only going to speak for 30 minutes because the gorgeous day outside. Get a glass of water, tea. I got mine here. And today's topic is lupus in the heart. See my heart? Anyway, if you suffer from lupus, you are at a 50% risk of developing coronary artery disease. Hey, Adelina. Hey, baby. Thanks for the hearts. Hola, from Puerto Rico. Hello, de la isla. If you suffer from lupus, you are at 50% risk of developing coronary artery disease. Patients with systemic lupus have a significant increased risk of cardiovascular events due to atherosclerosis. I had this issue. Okay, so evidence strongly suggests that an atherosclerosis plaque is largely driven by inflammation and an active immunological response. So premature atherosclerosis is a major occurring condition in SLE. Hey, love you, Adelina, my sister from another mister. Anyway, coronary artery disease, which I'm going to say CAD from now on. Thank you, sweetheart. So do you. Thank you, my love. I appreciate it. Mwah. Or atherosclerosis, which is the hardening of the arteries. And it is the #1 killer of both men and women in Western countries, whether you have lupus or not. So some top contributors to heart disease, whether you have lupus or not, is inflammation, smoking, bacterial infections, high blood pressure, poor immunity, and if you have lupus, it's an autoimmune disease where you have poor immunity. Hey Lisa, thank you for joining. Viruses, obesity, diabetes, eating unhealthy foods, okay, and emotional and physical stress. Now, all these things are really bad for you. It's bad for your heart, whether you have lupus or not. So women tend to have lupus more often than men. When CAD develops in women, it tends to become symptomatic in the 3rd and 4th decades of your life. So it will frequently manifest with chest discomfort, sometimes pressure, shortness of breath, sweating, profound nausea, vomiting, diarrhea, weakness. It is said that so-called typical symptoms of severe chest pain with radiation down the left arm, are less common in women, which is true because when I had my heart issue, I had nothing to do with my arm. It was all in my back, and I'll talk about a little bit about that later. So, I'm going to give you some tips. So if you're a woman, you know what the signs are. So the thing on the arm is less common in women, making it less likely for women to seek medical attention. So an incident of CAD in women who have lupus, it's not known, but it's higher in women than it is in men who have the lupus of similar age. So of course, men who have lupus can also develop CAD at an accelerated rate. So what are the heart attack signs for women? Well, when we think of heart attacks, like I said before, we envision a numbness in the arm. This is a symptom that is most often seen in men, and it may not be present in women. Women with risk factors for heart disease may show signs that are very different. One is chest pain, which is something that I had. Shortness of breath, stomach pain, jaw and neck pain, back pain. When I had my issue, I was getting pains in my back right here. And I always felt tired, fatigued. I would fall asleep all the time. Even if I slept for 10 hours straight, I would always be very tired. Yes, there is, Adelina, there is. And I'll talk more about that a little bit later on. I'm going to get to that, the LDL levels and the HDL cholesterol levels. But I'm also going to speak about cholesterol as well, because I think we're pretty misinformed about cholesterol as well. It's not as bad. Cholesterol is not as bad as you think it is, because we do need cholesterol in the body, but I'm going to get to that later. Okay. So like I was saying, my symptoms were different. I had pain in the back. I always felt tired. And if I was running for the train, I would get chest pain, and it felt like a coldness in the chest. It wasn't a severe pain. As I got closer to having a heart attack was when I started getting those chest pains and what you typically know to be the typical symptoms of a heart attack. But I never had the pain in the arm. Okay. So, signs of the heart attack condition don't develop overnight. Okay, it doesn't. The risk factors have probably been there present for a long time before the attack happened. So, what are the risk factors of atherosclerosis seen in patients with SLE? So, the traditional cardiac risk factors defined by the Framingham studies, such as high blood pressure, high cholesterol levels, do appear to play a role. However, these factors alone do not adequately explain the increased incidence of cardiovascular disease seen in patients who have lupus, including increased risk for stroke or myocardial infarction. The increased risk of atherosclerosis in people who have lupus there's many different factors going on there. So it can be resulting from a complex interplay between traditional cardiac risk. Hello, Cherry Lynn, hey, how are you, girl? I haven't seen you in a long time. Hope you're doing well. So I was saying the increased risk of atherosclerosis in people who have lupus, there are many different factors. It can result from a complex interplay between traditional cardiac risk factors and lupus-driven inflammation. Also, longer duration of the steroid treatment, because they put people who have lupus on steroids, that can create a higher incidence of atherosclerosis in patients with lupus, and may also impact the traditional cardiac risk factors such as hypertension, obesity, diabetes, in addition to the prednisone uses. So this is why I tell a lot of my clients who are on prednisone and other types of medication that I know can affect the heart, I have them speak with their doctor, especially if their lupus is more stabilized. I have them speak with their doctor and see if they can either wean them off the steroid and put them on some other medication. But that's something you would have to discuss with your doctor, and only if your lupus is stable. If you're having symptoms, I would not recommend you get off the medication. So an indirect complicating factor that may cause worsening of CAD symptoms is the adverse effect that lupus can have on the blood. Hey Alex, how are you? Welcome. This is called antiphospholipid syndrome, and from here on I'm going to call it APS. Okay, so APS is an autoimmune disorder that is characterized by excessive clotting of the blood in the arteries and veins, and I had this issue as well. This is what happened to me, and it caused me to have CAD, coronary artery disease. So usually blood clotting happens naturally in the body as the body responds to cuts and scrapes and small breaks in the blood vessels. Okay, that's normal. In APS, a tendency for excessive clotting can constrict or even block blood flow and end up damaging internal organs. So, and a tendency for blood clot is more easily in some patients, thus leading to a possible blockage in coronary artery disease. So, if you experience chest pain or pressure, I strongly recommend you let your doctors know that you're experiencing chest pain and discomfort, and have them run the proper tests to make sure that you are not at risk as, okay, because as a person who has lupus, you are, like I said, at a higher risk of getting APS or CAD. And people with lupus are now starting to live longer. So that also develops a higher risk of getting these illnesses and heart conditions. So a common heart problem in people with lupus is inflammation around the sac around the heart. And this can cause shortness of breath, sharp chest pains. Lupus can also directly weaken the heart by causing it to get inflamed. Now, these problems are usually treated with powerful inflammation fighters and medicines that can calm down the immune system, such as the steroids. But again, taking the steroids for a long time can cause a heart problem, so it's a double-edged sword here. So the most common cardiac involvement in lupus patients is pericarditis. And that's the pericardium is a connective tissue that surrounds the heart and cushions it in the chest. When it becomes inflamed by lupus and other inflammatory diseases, it can cause chest pain. Now, pericarditis is usually not life-threatening, but it can be quite painful, because I had my battle with that. And I mean, it's extremely painful. So if you have been recently diagnosed with lupus, you may confuse the pain of pericarditis with a heart attack. However, the pain is more similar to pleurisy. And what I mean by it is that it's worse. It feels worse when you take a deep breath. And it may be worse if you're changing the position, such as if you're leaning forward or laying down. So if you're suffering from lupus, and you develop chest pain, you should seek medical attention immediately, because you don't know whether it could be your heart or it could be the pericarditis. So you can know for sure whether the pain is being caused by either a heart attack or the pericarditis. This way the doctor can give you the right treatment for your issue. Also, aspirin and a high dosage may be the first line of therapy, but other more powerful agents such as steroids may be necessary, or non-steroid anti-inflammatory agents like ibuprofen are commonly used with pericarditis. So pericarditis usually resolves itself with treatment, but may return having you to do the therapy all over again. But it's very rare that surgery is necessary to remove the inflamed pericardium. Excuse me. I can never speak. Pericardium. Okay. Occasionally, excessive fluid may accumulate around the heart, between the heart and pericardium. Jesus Christ, what is wrong with me today? Pericardium and heart muscle, and may lead to other problems. Another disorder, when you have lupus and heart disease or heart involvement, is called valvular disorders. Just as the connective tissue of the pericardium may become inflamed, so too can the valves inside the heart can be affected. This is called valvular disorder, and up to 50% of lupus patients have some sort of valvular disorder. So involvement, but it is usually mild and only evident in 20% of patients who have the inflammation of the valves. Hey Carmela, how are you? Welcome. Nice to see you, girl. But it's usually mild and only about 20% of the patients. And inflammation of the valves usually causes no symptoms initially, and most patients will have complete resolution of the valvular involvement, but only after a period of time. Scarring can occur though, and results can be damage to the valve. So this can cause a leaky or improper blood flow inside the heart. Ultimately, this can lead to excessive fluid accumulation or heart failure. But less than 20% of patients actually develop significant leak over a period of 5 years. So when present, medical therapy is usually adequate to control symptoms and progression of the problem. Very rarely is it more aggressive treatment included or surgical valve replacement necessary. So patients who have this type of heart damage should be giving antibiotics, before most dental procedures, including cleaning and some general surgical procedures. Like I know every time I go to the dentist, hey Tony, how are you? Welcome. They always ask me, and they want to speak to my cardiologist to make sure that I didn't have that type of issue, and I don't. I don't need to take any antibiotics or anything like that. I've been able to reverse everything that the lupus did to my body, and I've been able to heal my body. And this is why I share all this information with you guys, because I want you to be able to do the same thing, or at least become a little bit healthier and have less symptoms. So occasionally the heart muscle can become inflamed in lupus patients. This is, it's saying storage almost full. I don't know why it said that. Okay, this is called myocarditis. Now, chest pain similar to what occurs in pericarditis or the shortness of breath may occur with myocarditis. Once again, most patients will have minimal symptoms, okay? Minimum. They're not anything, severe. But more severe cases of the heart muscle becomes permanently damaged. So the heart can enlarge and the muscle may become weakened and flabby, leading to congestive heart failure. So if you think you have this, go to your doctor, get checked. I would say if you have lupus, constantly have your doctor check your heart. You want to stay on top of that. You don't want to fall victim. Unfortunately, I fell victim to that, but thank God I was smart enough to go to the doctor and get it taken care of in time. Actually, when I went to the doctor to get checked, because I was misdiagnosed by this, and when I finally called a doctor who gave me the right information and sent me to the right place on that very day, was when I had the issue with my heart. Had I gone with my day as usual and not been proactive, I wouldn't be sitting here today speaking to you. I would be dead. So always be proactive. Always go with your gut. Your gut will never lie. Your gut will always tell you what's going on. And do your research too. So, all right, medical treatment includes anti-inflammatory agents as well as specific therapy for heart failure when it occurs. But it's very rare that surgical treatment will become necessary. And there are specialized tissues inside the heart that initiate and conduct electrical impulses that signal the heart muscles to contract in an organized fashion. These tissues, can become inflamed, and permanent damage can occur later if the structures become scarred. So during the early inflammatory phase, the heart can become overly excitable and can cause extra heartbeats, usually perceived as irregularity of the heart rhythm or palpitations. This is called heart arrhythmias, and these arrhythmias do not usually need treatment, but it's very troublesome to some patient. Medical treatment is very effective, and very rare are they dangerous. If the conduction system becomes damaged by scarring, signals may be blocked and the heart can be too slow, and that's not good. So in very unusual circumstances, the slowing might be serious enough to require treatment of a pacemaker. So I'm going to share some herbs that are good for heart health. Ginseng reduces cholesterol and has shown positive effects on blood vessel elasticity. Chinese angelica root is traditionally used to treat blockage and help increase blood flow. Sacred pine is a potent antioxidant. It has a potent antioxidant in the bark, needles, and nut that helps reduce inflammation in the blood vessels and lowering risk of plaque buildup. Also, ginkgo. Ginkgo increases microcapillary circulation and expands the blood vessels. And also hawthorn berries. Hawthorn berries reduce the fat and the mucus accumulation. It purifies the blood, improves blood flow. And I have a recipe for hawthorn berries tea on my website. I cannot get credit for that recipe. My mentor, Andrea Beedman, that's actually her recipe, but you can find it on my website if you go to the recipe section, or you can go to Andrea's and find it there. So these herbs are available as a combined supplement from Chinese pharmacies or in some health food stores. If you live in New York City, because that's where I am, folks, I'm in the Big Apple, New York City, there's an herbal store called Power Herbs. And you can go there. I think they're on 9th Street in the Village, or you can go online. If you don't live in New York, you can go online and check Mountain Herbs or do a search. They're out there. You could definitely get them. And some herbs like ginkgo possess mild blood thinning properties, so it may interact with blood thinning drugs. So if you are on any blood thinning drugs, do not take the ginkgo, okay? Or there's also one called white willow. You don't want to take white willow also, because both of them can cause thinning of the blood. And if you're already on some sort of medication from that, you don't want to take it. Also, I highly recommend you speak with your medical doctor and cardiologist before you take any of these herbs if you're already taking prescription medications. And I'm going to give a few lists right now of some foods that are good for the heart. Rosemary, it stimulates the blood, improves overall circulation. Walnuts, I love walnuts. It's also a brain food. It satisfies your hunger and it helps with your heart because it has omega-3s, fatty acids in it. Salmon, love salmon. I make an awesome salmon. Omega-3, it has omega-3 fatty acids, vitamin D, E. It reduces, which helps reduce the risk of heart attacks and strokes by decreasing clotting. And also wild berries. Wild berries are so yummy. But they are high in flavonoids, which help to counter the buildup of plaque and improve cardiovascular health. Antioxidants. It's also rich in vitamin C, supports a healthy immune system. And garlic. Garlic is one of the most important herbs for heart health. Fresh garlic is by far the most effective method of reducing cholesterol, but not good for everyone. It may irritate your gut. I know that if I take too much garlic, it really bothers my gut and it irritates my stomach. So be careful with the garlic if you have gut issues. And if you have systemic lupus, there's probably a chance that you have gut issues, whether you know it or not. Because a lot of people with lupus tend to have gut issues. Also, asparagus is filled with nutrients, such as beta-carotene, folate, and fiber. Now, cholesterol, Adelina, you had asked about this. Cholesterol is not all bad. Cholesterol is an integral part of many of our hormones. Estrogen, testosterone are just two of them. The sex hormones are important during puberty and beyond for the proper development and reproduction. So don't doom this naturally occurring substance too soon. Cholesterol is responsible for brain synapses. It's also responsible for vitamin D synthesis from cholesterol by action of sunlight on the skin. Cholesterol is needed for absorption of fat-soluble vitamins such as A, D, E, and K. Low-fat, low-cholesterol diets can be very unhealthy, especially in women. And all major hormones are made from cholesterol. Estrogen, cortisol, DHEA, testosterone, progesterone, all of that made from cholesterol. So we need some sort of cholesterol in our system. So the liver produces most of the cholesterol. Hey, Kimberly, welcome. The liver produces most of the cholesterol. If it is needed, it is processed from the foods we eat. There are healthy fats and not so healthy ones that we eat every day. Unhealthy ones come from processed baked goods, processed foods, candy bars, fatty meats, the like. You know what I'm talking about. We've gone over this before. Eating these foods once in a while is okay, but eating them often in large amounts, well, it affects your body, specifically your heart and your blood vessels. And you only need 20% of cholesterol from food, so be sure to check the labels on the foods you buy and eat. Choose foods and ingredients that contain healthy cholesterol like unsaturated oils like olive oil, flaxseed oil, or flax seeds. Any foods with healthy fats. These are foods with healthy fats. The nuts, like I said before, the cold water fish, avocado. Hey, Sonia, how are you? Oh, you're welcome, sweetheart. Anything for you, sweetheart. You know we go way back, and I want what's best for you, love. Mwah. God bless. And thank you for tuning in. So things that you can do. You can change your eating habits for one. A nutritarian diet. Dr. Joel Furman, which is someone that I studied with in nutrition school, he is really big on the nutritarian diet, and if you're interested in that, I would advise you go to Amazon and buy his book. He has several books on the diet and on inflammation. He's awesome. I learned so much from him. So choose more fruits and vegetables from folks out there in their 20s. You folks out there out in your 20s, you know, you eat a lot of fatty foods, McDonald's, Burger King, and all this other stuff. It may not put weight on you now that you're in your 20s, but it's still doing a number on your arteries. So watch what you eat, folks. Also, if you're a woman, change your birth control method, because birth control pills carry with it a risk of blood clots. And if you smoke, you're at a greater risk as well. And if you have lupus, you really shouldn't be smoking, period. Clots can lead to heart attacks. So I would say ask your GYN for a safer method of birth control. Also, get active. You want to burn calories, folks, okay? Each day for about 30 minutes of modern activity. It could be even just walking or hiking. I'm really big on hiking. In the past 2 years, I've gotten really into hiking, but I also work out at the gym. I do dance class. I do Zumba. I walk. You name it. You know, if I like it and I feel like doing it that day, that's what I'm doing. Now that the weather is getting nicer, I've been doing a lot more walking. Soon it'll be kayaking season, so I'll be doing that as well. Basically what I'm saying, you don't need to just be in a gym. There are other forms of exercise. So exercise, the wonders it does for your heart is it increases lung capacity, lowers blood pressure, causes the heart to beat more efficiently, okay? And it gives you more endurance, increases metabolism, and reduces stress. And you know, when you increase your metabolism, you tend to burn more fat. So what I would say is find what you like and just do it. Another thing I wanted to cover is the fourth chakra. As you all know, I'm into also energy healing and spiritual healing. And the chakras are the energy centers of our body. There are 7 main chakras. The one down here is the root chakra. You can't see. You have the sixth chakra, which is the sacral chakra, spleen chakra. The 5th is right here, which is your solar plexus. That's where your intuition is. The heart chakra. 3rd is the throat chakra, 3rd eye, and the crown chakra up here. When we are speaking of spiritual and emotional body, the 4th chakra, it is right here. So what do you think that is? It is the center of the 7 chakras. There are 3 below and 3 above. And this is the area where all physical and spiritual meet. The 4th chakra, also referred to as the heart chakra, is located in the center of the chest and includes the heart, cardiac plexus, thalamus, the thalamus glands, lungs, and breast. And it also rules the lymphatic system. And in Sanskrit, the word 4th chakra is called anahata, which means unstuck and unhurt. So the color associated with the fourth chakra is green. The element is air. And when your heart chakra is balanced and open, you are flowing with love and compassion. You're quick to forgive and you accept love and you love others and yourself. When your 4th chakra is out of balance, closed, the heart chakra can give way to grief, anger, jealousy, fear of betrayal, hatred towards yourself and others. And, you know, that's not good. That's not good for the heart. So what we want a balanced 4th chakra. It gives us the ability to have belief in the divine plan, the ability to reach out and hug someone. Now that's a strong and loving 4th chakra, okay? When our 4th chakra, heart chakra, is out of balance, the physical and emotional dysfunctions that can occur are, can you guess? Can you guess? You can't? All right, I'm going to tell you. Heart disease, pneumonia, breast cancer, okay? Giving too much, taking care of others first and exhausting yourself, giving too much to others. You know, it's nice we want to help people, we want to be good people, but you got to love yourself first. You got to do you first, period. Okay? Also, allergies, respiratory problems, lung cancer. We tend to suffer from upper back pain, hanging on to bitterness and anger from the past, from past relationships, inability to forgive, like I said before, jealousy, and being overexcitable. For example, okay, arm crossing like this, if you cross, and I find myself doing this sometimes, like this, is an emotional imbalance. Could be physical. It could be you're protecting your heart, lungs, breast. Could also mean a heart condition. Sometimes when people do this, like one of my good friends, she always has her hand down here, like here, by this area. And I didn't know this, but she had issues there. She had issues in that area with her female reproductive system. So it's funny, you know, the body gives out clues sometimes. And if you're in tune with spiritual healing, energy healing, you'll notice these things, these clues on yourself, as a matter of fact. So to heal an imbalanced fourth chakra, what you need to do is a lot of forgiveness work. Letting go of the past, releasing anger, learning to love yourself as well. Forgive yourself. Forgive yourself for all the things that happened in the past. Look at them as lessons. You know, we all go through these things, and there's a reason for everything. Everything that happens in life, there's a reason for it. So you need to love yourself. Give yourself some love and hugs. And I'm sending you a big, big, big hug and a lot of love, okay, for your fourth chakra. So healing the fourth chakra, also healing foods are green colored foods because the color of the fourth chakra is green. Like leafy green vegetables, spinach, green tea, okay? I wanted to touch on also, now we're talking about traditional Chinese medicine, on the bitter flavors, okay? According to traditional Chinese medicine, the bitter flavor is connected with supporting the heart and the heart health function. So bitter flavored foods and herbs can help cool the body and drain excess heat. When you have a heart condition, there is excess heat there in TCM, traditional Chinese medicine. If someone is suffering from a heart disease, they actually may be better off eating something bitter rather than something sweet, because sugar causes inflammation in the body. And if you have lupus, you already have inflammation going on. So bitter foods for good heart health include kale, parsley, endive, arugula, dandelion. And dandelion is also good for the liver because it's a good liver detoxifier. And those are just a few that I wanted to name. There's tons of them out there. You can do the research. You can Google them. Or you can email me, reach out to me, and I can send you a list. Also, stress. Stress is a part of life. Again, it says... storage almost full. Stress is a part of life. Left unmanaged can damage your body, especially your heart. Physical stress and emotional stress can put a lot of strain on your heart. Stress can kill you. It can really, really kill you. When your body reacts to stress, our body goes into the fight or flight mode all the time. Constant unmanaged stress can lead to high blood pressure. The vessels in the blood can become weakened due to the pressure, and this leads to it leaves you wide open to plaque formation and aneurysms later on. When we don't know how to manage stress, it can lead to many poor choices and bad behaviors like smoking and drinking and eating crappy foods. Also, if you smoke, and if you suffer from lupus, like I've said before, if you suffer from lupus, you should not be smoking, really. And if you are, find a way to quit. Smoking is another habit that increases heart disease. Smoking decreases the lung capacity, and the nicotine causes the blood vessels to become less elastic. Also, drinking. Drinking is yet another habit that is picked up during times of stress, and I'm talking about excessive drinking. Alcohol affects your liver. The liver filters the blood, processes cholesterol, and triglycerides. When the liver working improperly, you can develop metabolic imbalances in the body, leading to diabetes and other diseases. Also, managing stress is very, very important to your overall health. The effects that stress has in your life goes beyond sleepless nights. It really, really affects your health. So what I would recommend is try to find some stress relieving techniques, whether it's meditation, prayer, exercise, anything that you feel that relieves your stress. A massage. I love massages, and that really helps to reduce stress. Find something like that to help you reduce your stress, okay? And know that the only person who can help you reduce your risk of any disease or any illness is you, okay? Only you can make yourself healthy. Only you can help yourself. I mean, the doctors do help you, but you also need to participate in your own healing journey. So get up, move around, live an active life, be happy. You know, this is all I have to share for now, folks. And there's so much more that I can talk about lupus and heart health, but we'd be here all day, and I have stuff to do. I will be having tons of information on my lupus group program, which will be launched in the fall. If you want more information about the program, go to my website, YvetteLeBoy.com, sign up for my newsletter, and, you know, I'm going to keep you updated as to what's going on with that. I wanted to recommend 3 books, like I always do. And the first book, of course, I'm going to recommend Millie's book, Befriending the Wolf, A Guide to Living and Thriving with Lupus. And she's going to be one of the expert speakers in my lupus group program. I had the opportunity to meet her. She's so awesome. What a nice, beautiful human being she is. And I'm honored to have her to be one of the speakers in the lupus group program. She has so much stuff to share with you folks. I can't wait. And another book I want to share with you, it's actually my mentor's book. And it's Happy, Healthy Thyroid, Essential Steps to Healing Naturally. And it's by Andrea Beeman. And she is my mentor. I love this woman. And why I'm sharing this with you, because there are a lot of people out there who have lupus that are also suffering from thyroid disease. And if you suffer from thyroid disease, I highly recommend you reach out to her. Her name is Andrea Beeman. Love her to death. She's so awesome. And 2 more books. One is called The Heart in Systemic Autoimmune Diseases. That's the Handbook of Systemic Autoimmune Disease, and that's by Fabolia Antlin, Andrea Doria, Mike Muhammad, and Paolo Poletto. Okay? And that book is called The Heart in Systemic Autoimmune Diseases. And it talks about heart health, and it talks about autoimmune diseases and all this other stuff. And last but not least, I want to give you one more book. It's called The Inflammation Diet for Beginners. A lot of you emailed me to ask me how can you start with an anti-inflammatory diet. Well, this book has 100 anti-inflammatory recipe, and that is by Shasta Press. And the name again is The Inflammation Diet for Beginners. Okay? Like I said, if there is a lupus-related topic you have or a health topic you'd like me to speak about, email me at YvetteLeBoy.com. Follow me on social media. On Facebook, you can follow me at Yvette LeBoy Coach or From Lupus to Living. This is my last live chat I'll be doing on my personal page. I'm going to move this over to my business page, which is Yvette LeBoy Coach. I'm going to be doing the talks from there. So if you're on this page, I highly recommend you go and you like Yvette LeBoy Coach and From Lupus to Living. On YouTube, you can find my YouTube videos, and this will be on there posted soon. I'm Yvette LeBoy on YouTube, Twitter, Holistic Gal, Instagram, One Holistic Diva. And you can visit my website, which is YvetteLeBoy.com, and you can check out my recipes there. I have a blog, and I have some really great information. And you could also reach me on there, too. I have a contact information, and that is YvetteLeBoy.com. So I am Yvette LeBoy. I am from YvetteLeBoy.com. We inspire people to get healthy and transform their lives because we want you to become that fabulous diva and divo you were born to be. Thanks for tuning in. I'll see you at my next live chat. I'm not sure what the topic is going to be. If you guys want to hear something, email me. But I won't be next week because I'm not going to be around next week. I'm going to go to a convention. But the following week, I'll be doing another live chat. And that will be at YvetteLeBoy.com. So, thanks for tuning in. See you at my next live chat. Love you. God bless. And stay heart healthy. Take care. Bye.